Hari Om. We will talk about some important physiological changes during pregnancy. Now, as the word suggests, they are physiological changes. It means that they are natural changes, they are normal changes which occur during pregnancy so that the mother can support a new life, the baby growing in the mother's womb. So we are going to talk about the natural normal changes. We are not going to talk about any abnormalities, about any disease conditions during pregnancy. So please take a note that all these changes, they are the normal changes which occur during pregnancy. Now, as we are talking about pregnancy, the first important change to be noted is in the reproductive system. Of course, everyone is very well aware that during pregnancy, the menstrual cycle, it stops. The menstruation, it stops. Because during pregnancy, the ovulation, the formation of new ovum is stopped. And so the menstrual cycle, menstruation, it will stop temporarily during pregnancy. At the same time, the mother would experience some changes in the vagina and the cervix. These parts, they become more soft. The secretions in the vagina, they increase. Even the secretions in the cervix, they increase. The blood circulation around vagina and cervix will increase because of increased capillary network, increased vascularity in the vagina and the cervix. Now, as the secretions increase, especially in the cervix, they are mucus secretions, and this mucus, it will form a plaque, it will form a bud, and it will shut down, it will close the opening of the cervix. So the opening of the cervix is closed all throughout pregnancy, and it helps preventing from the infections traveling towards the uterus. And the length, the size of the cervix is also increased. It becomes elongated, which is further helpful for supporting the uterus and supporting the pregnancy so that the cervix remains closed all throughout the pregnancy. There are also some changes in the breast. So there can be heaviness of breast, and the enlargement starts during the early pregnancy itself. The areola, the dark part around the nipple, it further becomes more darker, and the area, it also increases. So around the nipple, it will be more darker, and the nipples will start popping out slowly. Secretion of the milk or a secretion of a liquid from the breast can start coming out of the nipples, oozing out of the nipples as early as the third month of pregnancy. So in the first trimester itself, some mothers may experience this secretion, which is called as colostrum, starting to come out of the nipple, but it's quite natural, it's quite normal. This is because of the improved vascularity, improved blood circulation to the breast, and the opening up of the ducts which are connected to the glands. So these secretions, they are quite normal, and can be expected in the first trimester early during the pregnancy. Also, the size of the uterus will go on increasing during pregnancy. It is quite obvious because when the size of the baby increases, when the weight of the baby increases, the uterus, the muscular bag, it will also go on stretching and the size will increase. As early as maybe around 10 to 12 weeks, the uterus will come out of the pelvis. By around 20th week is as high as the umbilicus, and the size will go on increasing during the pregnancy. Now, previously, depending on the size of the uterus, the duration of pregnancy was calculated, but nowadays ultrasound technology, it is helpful and it can actually calculate the weeks for the pregnancy. So nowadays most reliable technique would be the ultrasound rather than measuring the height or trying to find out where the level of the uterus is. This is just for our brief understanding how the level of the uterus it will go on increasing during pregnancy. But it is also important to note that the uterus it will become more and more circular initially in a non-pregnant state or even in the early weeks of pregnancy. The uterus is anteverted or it is slightly bent in the forward direction, but then as the pregnancy goes on progressing, the uterus it goes on becoming more and more circular and more straight so that it is not bending in the forward direction. Next, we can also notice some changes in the skin. So during pregnancy, as we said earlier, the breast, the areola specifically, they will become darker. That's because of the excessive pigmentation around the nipples. So that is one change which we can also consider under the changes under the skin. Other important changes, they are pigmentation around the eyes, around the cheek, or even on the forehead, which is very obvious in some mothers, but it may not be seen in others. Like it's not necessary that every mother would have this pigmentation around the eyes, forehead, and cheek. Then there would be striations, stretch marks, which is commonly called. Of course, it would be more prominently seen in the abdominal area, but it would be very, very prominent below the belly button, the umbilicus, and even over the thighs. So this striations, striae gravidarum, or striations of pregnancy, they would be quite obvious even after the childbirth, like the stretch marks which remain after the childbirth. It is because of the skin not being that elastic. It is stretched a bit more and it creates markings over the surface. And then there can be some vascular changes, some microcapillary changes which occur over the skin, which are called as the vascular spiders, and which can be seen. They can be multiple or they can be one or two in the different parts of the body. So just to give you a brief understanding of these skin changes, the pigmentations, we move on to the next slide. This is the pigmentation, what we were talking of around the eyes or the cheeks, the nose, which would be sometimes obvious around 20-24 weeks of pregnancy. These are the striations over the abdominal wall, abdominal skin below the belly button. These are the vascular spiders. Now, these kind of eruptions or these kind of findings over the skin, they are quite normal. It doesn't need any treatment. This is because of the improved blood circulation, improved capillary network all over the body, and especially under the skin. This capillary network, it can be seen, which is called as the vascular spider. It can be single, maybe one or two here and there, or there can be multiple of them. Moving on to another obvious thing is weight gain. It's quite obvious that there would be weight gain during pregnancy. Now, approximately it is said that there can be weight gain of around 9 to 12 kilograms all throughout the pregnancy, but there is no rule for it. It actually depends on the nutrition, how much food the mother is eating, the exercise what she is doing during pregnancy, the amount of rest what she is taking during pregnancy, of course, her initial weight before pregnancy. All these factors, they contribute for the weight gain. But approximately you can expect around 9 to 12 kilograms of weight gain. And as such, there is no rule specifically that how much weight gain would be there in the first, second, or the third trimester. Some mothers, they may gain weight during the first trimester. Some of them, they would gain more weight in the last trimester. So there are multiple factors. Of course, there would be genetic factors also responsible for this weight gain. But then, as I said, ultimately we can expect around 9 to 12 kilograms of weight gain during pregnancy. Now, when we say this weight gain is expected during pregnancy, the variation which would be there for different mothers is because of the fats and the proteins. 3.5 kg, as I have mentioned here. Some mothers, they would put on more fats. Some mothers, they would put on less fats. So the weight gain, the total weight gain during pregnancy would vary depending on the fats which they put on during pregnancy. And as said earlier, it depends on their nourishment, their sleep, their exercise habit, and many other things. But then approximately the weight gain for the baby or the baby's weight in 9 months, it would be around 3 plus kg. Then the placenta, the uterus, the fluids, they would be around 2.5 kg, and the blood volumes, or because of the increased fluids in the body, it would be around 2.5 kg. The only variable around would be the fats and proteins, which might be more or less depending on the nourishment, the rest, and exercise. Now, talking about some of the most important changes in some important systems of the body. First, we will talk about the heart and the blood circulation. Now, as a requirement of nourishment to the baby, as a requirement of supplying oxygen, as a requirement of supplying nutrients to the baby, the blood volume in the mother's body, it increases by approximately 30 to 40%. So the total quantity of blood flowing in the mother's body would increase by around 30-40%. But while this volume is increasing, the liquid part of the blood, the plasma, it increases very fast and quick. But proportionately, the number of cells, the red cells specifically, it requires a bit more time to increase. So it is called as a relative anemia because the plasma volume has increased fast and quick, but in that proportion, the red cell volume has not increased. Of course, this increase in the blood volume is because of the increased demand of oxygen, because now the mother requires oxygen and the baby also requires oxygen. So the quantity of blood or the blood volume increases, and because of this increased blood volume, up to a certain extent, the heart rate of the mother can also increase. Now, throughout pregnancy, there is a bit more level of progesterone. So the effect of progesterone is not only on the uterus, but the effect of the progesterone, it would be also on the blood vessels, which usually become soft and they dilate, they increase in size. So there is a stagnation of blood circulation, especially in the lower legs, and which can lead to a condition called as varicose veins. Varicose veins is a condition which can occur in anyone, but the risk of developing varicose veins would be more, especially during pregnancy. And if the mother is not exercising, the chances of varicose veins definitely increase. Now, as the uterus is growing in size, as the baby is growing in size, the heart also is actually pushed a bit upwards and more towards the left side of the chest. And a very sensitive mother might hear some sound over the heart area when she's sitting, when she's sleeping calm and quiet. A kind of hissing sound would be heard on the heart area, or it can be even palpitations. Palpitations is you're able to hear to your own heartbeats. Usually we don't hear our own heartbeats, but when you're sitting calm and quiet and you are able to feel, if you're able to hear your own heartbeats, it's called as palpitations. So it's quite common during pregnancy. And it's because of the increased workload over the heart. Because initially, in a non-pregnant stage, the mother's heart was pumping out around 4.5 liters of blood. And now this same blood quantity, it has increased to about 6.25 liters. So from 4.5 liters to 6.25 liters, as we said earlier, 30 to 40% increase in the blood volume. So the amount of blood has increased, but the heart muscles, they are the same before pregnancy and during pregnancy. So that can lead to palpitations. And as far as the blood pressure is concerned, it would be usually normal and sometimes it can be even below normal. Having high blood pressure during pregnancy is considered as risk. Another system which we need to talk of is the respiratory system. Now for the respiratory system, the demand of oxygen has increased. As the baby is dependent on the mother, the baby is going to receive this oxygen through mother. The baby is going to receive the oxygen from the mother's blood. And at the same time, the carbon dioxide, which is generated in the baby's body because of the metabolism, because of the various life processes going on in the baby's body, baby's cells and tissues. The baby is going to generate carbon dioxide, and this carbon dioxide is to be removed from the body by the mother. So excessive more requirement of oxygen and at the same time more generation of carbon dioxide, which is to be thrown out of the lungs. But then the enlarged uterus, the grown up uterus and the baby, they create some restrictions over the movement of the diaphragm, the respiratory muscle. So the abdominal muscles, the respiratory muscles, they cannot move as freely as they were moving before pregnancy. And this causes shallow breathing, and it can also cause breathlessness. So the breathing becomes more of thoracic, less of abdominal, and it's not a full breathing, it's a shallow breathing. Also, in the respiratory system, there is increased secretion of mucus, as we talked about increased secretion of mucus in the vagina and the cervix. Similarly, most of the tubular body parts, they have increased secretion of mucus. Now, this increased secretion of mucus further interferes with the process of breathing. It interferes with the process of exchange of oxygen and carbon dioxide. So on one hand, the demand of oxygen is increased, but then there is a bit difficulty of breathing and leading to breathlessness. So this is for your understanding how the size of the uterus as it goes on increasing, how it pressurizes or how it displaces the digestive system and the lungs. So roughly by the end of 20 weeks, the uterus has occupied more than half place in the abdominal area. So even the digestive system is receiving less space in the abdominal area and the heart is pushed upwards as mentioned earlier. So the heart is pushed upwards, the lungs are a bit compressed and the digestive system is displaced, is compressed as the pregnancy progresses. So there are effects on the digestive system also. The requirement of energy for the growth of the baby, most importantly the baby, and also the growth of the placenta or even the growth or secretion of the milk in the breast, the energy requirement is increasing. But as we saw earlier, the size of the uterus, it is causing displacement of the intestine, which leads to slow digestion. It also leads to slow movements of the intestine and slow absorption of the nutrients. So on one hand, the demand for nourishment, the demand of nutrients, the demand of energy is increasing, but the digestive system is not capable of absorbing that much amount of food, or rather, the process had slowed down. Also, the movements of the digestive system would be disturbed because the muscle tone is lost. And because of loss of muscle tone, especially the cardiac sphincter or the connection between the esophagus and the stomach, it becomes loose and there is a possibility that the contents of the stomach, they can go in a reverse direction into the esophagus and to the throat. It is called as the regurgitation of the food from the stomach in the esophagus. And then as the movements of the intestines are slowed down, similarly, the emptying of the stomach contents into the intestines, it will take longer time. Or in other words, the food will remain into the stomach for a longer duration of time. Also in the mouth, some mothers, they may experience some bleeding through the gums during brushing, and the gums, they are a bit swollen and spongy, then it's quite natural, it can happen in many cases. Next, the urinary system, the uterus, it compresses the urinary bladder. It will not interfere with the functions of the kidney because kidney, they are solid structures, they would not be compressed, so it will not hamper with the filtration process. But then, as the urinary bladder is compressed, the frequency of urination would increase. Or even there would be some loss of control over the process of urination. It can be because of mental factors also like stress and anxiety, but mostly it is because of the compression of the urinary bladder. So there would be frequent urination in small quantities, and there is a possibility that some urine it remains in the urinary bladder. Urinary stasis. The urine cannot flow freely from the urinary bladder outside the body. And all these things ultimately can lead to frequent urinary tract infections. If a proper hygiene, personal hygiene is not maintained, there is a possibility of frequent urinary tract infections. Now, changes in the joints, the muscles, or what we call it as the locomotor system. The posture is totally disturbed because of lack of proper alignment, lack of awareness of the posture. And because of this lack of alignment, there is a development of lordosis, more curving at the lower back, which can lead to backache. Now, this lordosis is also because of overstretching of the abdominal muscles, because the abdominal muscles also help in maintaining the erect posture of the backbone. But then, as the abdominal muscles are overstretched during pregnancy, and also the lower back muscles, they are weakened, the joints, they are relaxed, it would lead to lordosis, more bending, more curving in the lumbar area, and then it can be one of the reasons for backache during pregnancy. Also, cramping in the legs can be common because of excessive pressure around the lumbar area and the sacral region, because that's the main part from where the uterus has started to increase in its size. So more pressure is felt in the lumbar and the sacral region, and this pressure can cause the compression of nerves, compression of the blood circulation, which can lead to some cramps in the legs. And also because of the relaxation of the joints, the muscles becoming a bit more loose, it can also affect on the walking. So the walking can also be a bit different, changed gait during pregnancy. Very importantly, there can be some mental changes, some emotional changes. Of course, they would be different depending on the personality, but then usually there is emotional instability or emotional overacting irritability is quite seen. Some amount of depression can also be experienced during pregnancy, or there can be stress and anxiety. But then it becomes difficult to cope up with various life experiences, especially the emotional life experiences. To cope up with them, it becomes a bit difficult. So, depending on the person, depending on the people around the person, depending on the environment, the mental and emotional changes can differ, but then definitely there would be changes, there would be mood swings during pregnancy. And in the end, talking about the metabolism, as the energy requirement is increased, Definitely, the metabolism, the basal metabolic rate is also increased, and that increase is around roughly 30%. So there is increased metabolism of proteins, increased metabolism of carbs, and at the same time increased metabolism of fats. It's important to note that new proteins are being formed during pregnancy, and at the same time some extra fats would be stored during pregnancy. Of course, as we said earlier, it will depend on various factors like the nourishment, eating habits, the exercise, the amount of relaxation and sleep what the mother is taking. But then definitely there would be increased in the storage of fats and proteins in the body. And then it's important to note that usually the fasting blood sugar is usually lower, and the sugar levels can sharply increase after taking food. So the sugar levels they would be reducing and increasing, and there will be a large variability in the level of sugar during pregnancy. So this is in short the normal changes, the normal natural changes, physiological changes in the most important systems of our body during pregnancy. Hari Om.